Hi, my name is Ron Miller. I'm a medical malpractice lawyer at the law offices of Miller and Zois. My firm handles insulin overdose cases throughout the country. Prior to the discovery of insulin, diabetes was a death sentence. Managing the condition required a strict diet, reduced carbohydrate intake, and even that was not enough to reduce mortality. It was just awful. But that all changed in the early 1920s when a surgeon by the name of Frederick Banting and medical student Charles Best discovered that insulin can reduce blood sugar levels. Insulin is a hormone that is naturally produced in our bodies. It functions by allowing our cells to uptake glucose and convert it into a form that can be used by our cells for energy. Naturally occurring insulin is produced in our pancreas and is released when we eat food to maintain a normal level of blood sugar in the body. People with type 1 and sometimes type 2 diabetes no longer produce enough insulin to normalize blood sugar levels. As a result, they need to take laboratory-created insulin to mimic the action of the naturally occurring insulin that the rest of us have. Like all medications, you need to take insulin in the right amounts. The wrong amount can severely harm a patient, and we've seen it a number of times in our practice. Excess insulin in the bloodstream can cause cells in the body to absorb too much glucose from your blood. It causes the liver to release less glucose. The condition is called hypoglycemia. Initial symptoms of low blood sugar include sweating, clamminess, chills, lightheadedness, dizziness, confusion, anxiety, shakiness, hunger, double vision, and irritability. If left untreated, the condition can quickly progress to seizures, coma, and death. And like I've said, we've seen this in our practice, unfortunately. Low blood sugar from an insulin overdose can be easily treated with glucagon, intravenous dextrose, and electrolyte solution. But the condition must be caught and treated quickly. There are a number of patients in nursing homes and hospitals all over the country that are receiving insulin on a daily basis. It's critical that these patients, nurses, and doctors pay careful attention to the amount of insulin these patients are getting. They got to look at their blood sugar levels and signs and symptoms of a possible insulin overdose. Oftentimes, medical malpractice occurs in these cases because the healthcare provider was not carefully monitoring the patient and their symptoms. As a result, they didn't react in time to prevent the patient's death or severe injury. Again, our law firm handles these insulin overdose cases. If you have or have a family member who suffered an insulin overdose and you think medical malpractice could be the cause or a contributing cause, call me at 800-553-8082. Thank you.